Did you know that you can have high blood pressure during your pregnancy and not know it? I'm Dr. Carolina Melgar from HELLP. I'm a practicing cardiologist with 11 years of experience. So, most women don't experience any symptoms of high blood pressure. So, how can we know if yours is too high? In this video, I want to cover 6 possible high blood pressure symptoms that you should always look out for during your pregnancy. Plus, you'll learn how easily follow your blood pressure readings at home. Let's start with answering some of the questions from my viewers. This one is from Allison from Austin, Texas. What is blood pressure? Well, Allison, blood pressure refers to the force of blood that pushes through your arteries. If you have too much pressure, aka hypertension, this damages your arteries, especially the inner wall of these arteries called the endothelium. For every one of us, high blood pressure is the leading cause of serious problems like heart attacks, stroke, kidney failure, and more. But during pregnancy, and especially during delivery, this can cause an additional set of challenges. High blood pressure during pregnancy is becoming more and more common. In fact, it's the most common disorder in pregnancy. And according to the latest studies, it's also a major cause of maternal and prenatal deaths. Okay, now this one is from Charlotte in Denver. What is my normal blood pressure? A normal blood pressure reading for pregnant and non-pregnant adults is less than 120/80. But there are different ways that high blood pressure can sneak up on you. If you experience high blood pressure before you became pregnant or before 20 weeks of your pregnancy, this is called chronic hypertension. But if it starts after 20 weeks and goes away after you had your baby, this is called gestational hypertension. If you have chronic hypertension, your doctor will most likely change your medication to provide you with the ones that are safe for your baby, and will probably put more emphasis on monitoring your blood pressure throughout your pregnancy. Okay, so next we have a question from Ava from Jacksonville, Illinois. What complications can I have from high blood pressure when I'm pregnant? Well, here are some complications for the mother and a different set of complications for the baby. The mom can have preeclampsia. This means that the high blood pressure has started to cause organ damage, and it could lead to eclampsia. That's when seizures take place. There's also a risk of placental abruption. This is when the placenta separates from the wall of the uterus. And finally, there's also a risk of needing a labor induction. This is when we administer medication to the mom to start her labor. And the complications that can affect the baby. For example, he could have a preterm delivery. That means he's born before 37 weeks of pregnancy, and he could have low birth weight. This means he's less than 5 pounds 8 ounces. So Ava, those are the complications. And now let's dig into those 6 high blood pressure symptoms. Number 1, persistent headache. I know that headaches and migraines can be a cause of many other things, but a headache that doesn't go away can be a sign of high blood pressure and preeclampsia. It probably won't go away with over-the-counter medication, and it could come along with vision changes like blurred vision or seeing bright lights. So it's a good idea to get your blood pressure measured in these cases. Number 2, swollen hands and feet. This may be the most common high blood pressure symptom when you're pregnant, but it could also be a normal sign of pregnancy. So how can you tell? One suggestion is to see if your skin holds a dimple after you press it for a few seconds. This is also known as pitting. It could be a sign that the swelling is not normal. Number 3, nausea or vomiting. Now, I know that you're going to tell me that morning sickness is very common during pregnancy, but what's the difference in this case? Typically, morning sickness, well, it happens in the morning and it usually disappears after your first trimester. Now, if you suddenly feel nausea after the second half of your pregnancy, try to get your blood pressure measured. It could be a symptom of preeclampsia. High blood pressure, especially during your pregnancy, can cause changes in your vision, like I just mentioned, like blurry vision, your spots, or flashing lights, or even light sensitivity. If this happens, it's also an opportunity to have your blood pressure checked. Number 5, abdominal pain. Now, this is a tricky one because the pain in your upper right or middle part of your belly can be a sign of HELLP syndrome. Some experts consider that this syndrome is the most severe form of preeclampsia. It basically stands for hemolysis, elevated liver enzymes, and low platelets. just like we're showing here on the screen. It's a life-threatening complication, and it usually occurs during the later stages of pregnancy or soon after childbirth. Number 6, shortness of breath. Now, I know some of you moms out there are going to tell me, "Doctor, I've been out of breath since my 3rd trimester." And of course, you can even get used to feeling like this. But I'm talking about feeling an acute shortness of breath. High blood pressure can cause extra fluid in the lungs, which can cause shortness of breath. So again, another situation to have your blood pressure checked. So remember, many women don't experience signs of high blood pressure during your pregnancy. That's why it's important to consider getting a home blood pressure monitor. How to measure your blood pressure at home? Well, the only way to know whether you have high blood pressure is to measure it. Each prenatal visit, your doctor will likely check your blood pressure using a cuff. It's a standard tool used during checkups. Now, home blood pressure cuffs can also be used between checkups to track your health. If a doctor suspects you might be having high blood pressure, he might recommend you to start checking it at home. This allows you to take measurements during several days and write them down. That way, the next time you see him, this information is incredibly valuable. I have many patients that have high readings when they come to see me in the office. And this is usually because they're nervous, or they've been waiting for a long time, or maybe they were just in a rush to get there. Whatever the reason, I know that many of my patients are going to have high blood pressure readings in the office, and when they go back home, their readings are very likely to go back to normal. Blood pressure cuffs generally work the same way. Secure the cuff about 1 inch above the bend of your elbow, squeeze the bulb or press the button for the automatic cuff inflation, and then just leave your arm very still. When the cuff automatically deflates, the pressure reading will be displayed in the monitor. Remember that every blood pressure reading is made of 2 numbers. The systolic blood pressure is the highest or the first number, and the diastolic blood pressure would be the second or the lower number. Don't forget that a normal blood pressure reading for pregnant and non-pregnant patients is less than 120/80. Unfortunately, whether or not you're pregnant, high blood pressure symptoms don't always present themselves. More often, you won't know you're having high blood pressure until your doctor takes a reading during a checkup. Since there's usually no signs, the best way to know if you have high blood pressure is to monitor it at home. So that's it for today. I hope you enjoyed this video. I'm Dr. Carolina Melgar from Sono Health. Thank you for watching.